Hi everyone. How is everybody doing today? On my end, by the grace of God, everything is well. And I hope this is the same for everyone, no matter where you are across the globe watching my video. Um, some of you today may be your first time seeing me. My name is John Jay. And just to give you a brief background, I'm a registered nurse. I'm also a nurse educator. So time and time, I bring different topics. I share different tips on various healthcare issues. And my ultimate goal is to create awareness on some proactive step that we can do personally to take charge of our health. So I'm sure we've all heard about the team that says prevention is better than cure. Okay, so the ultimate goal, I'm sorry, I think this is a bit loud. So the ultimate goal for my posting is to create awareness that we can all take these different self-care measures at home before we find ourselves in a situation that's beyond our control. So like I said, this month we are still in March, and so we are still in Kidney Awareness Month. So I'm still going to be talking about issues that affect the kidneys and different steps that we can take. So without wasting time, I want to go straight into my topic today. Last week I shared on the different signs and symptoms that you may be experiencing that can indicate to you that you are heading into kidney failure, or if you are not already in kidney failure. So I share those symptoms with you. If you are not here, I can go over it briefly. One of the symptoms I said, you will feel extremely tired. You may have itching, you may have swelling, which is edema in your ankles, your feet, your legs, your hands, your face may be puffy. You may be having shortness of breath. So those are just the name of few. So if you have chronic high blood pressure, or if you have diabetes and you find yourself having some of those symptoms, know that you are in kidney failure, and you should be discussing those symptoms with your doctor. Do not delay. You want to start talking to your doctor right away. So today, I'm going to be speaking on the different treatment options for kidney disease. Now, I'm sure many of you may not know it, but there are different options out there to treat kidney failure. So if your kidney stops working completely, and by that I mean, within the kidney, there's a filtration system that's built within the kidney, and that filtration system, which is called is a glomerular system. That system tells us at what rate your kidney is filtering your body of all the toxins, all the excess fluid that get into your body. Because every day there are toxins that enter our body from the air that we breathe, from things that we put on our skin, from the food that we eat, from the water. So every day we come into so many different toxins. Even just the food that we eat, all the preservatives and things that they put in there to keep the food fresh for a long period of time. Those are all toxins that can enter our body. So when your kidneys are working, your body is able to filter, out those things that we don't need and keep those things that we need to create that balance. But when you start going into kidney failure, your body is not able to do that. So all those toxins and stuff stays in there and accumulates over time. And then when your kidney is not working, it can be a huge issue for you. But if you get to that point where that glomerular filtration rate, which is the rate at which your kidney is filtering your body, your blood of all those toxins, is around, let's say, if it starts heading to 20% or less, then you want to start thinking about, what are my options? What is the next step? Because eventually it's gonna you're gonna end up in kidney failure, and you're gonna need dialysis. You're gonna need some form of treatment in order to save your life. So I'm gonna be sharing those different options, so you'll have a general overview on what to expect, and then you can start thinking in that mindset. Maybe you can reach out to your doctor to get more information on those treatment options, or if you want to reach out to me, or if you have any further questions, you can just send me a message on Messenger, and I can address it to you to the best of my ability. If I don't know the answer, because I'm not perfect, I will do my research. I can, find a way to get you the right information that you need. So when it comes to kidney failure, there are different options out there for treating your kidney failure. Okay, kidney failure or kidney disease should not be a death sentence, and it's not a death sentence. There is no cure, I said previously, for kidney disease, but there are treatment options that can help you live a longer and a longer life, a good quality of life. All right, so the options out there, the first option for treating kidney failure is transplantation. Kidney transplantation, which is the first one, and this one requires some type of surgery. So it's a kidney transplant. So with this one, there are different kinds of ways that you can receive this kidney. Okay, so it simply means you get a kidney from somebody. Either that person may be a living donor, so someone that is still alive. It can be a family member, it can be a friend, it can be a random person that chooses to give you a kidney, because we can all live on one kidney. Okay, one kidney is sufficient to filter in the system. So a living donor, someone who is alive and know that you have kidney disease, and you share that information with them, and if they are willing to donate their kidney, then that's how the transplantation take place. So you both will undergo various amount of testing just to make sure you are all good, that there will be no complication. They will make sure your heart is good, your entire body is good. You will undergo a complete evaluation to make sure they can safely do this transplant. Then they will take you both into surgery. They will extract the kidney from that living donor, and they will implant that kidney in you. So that's one way in which you can get kidney transplant. Another way you can get kidney transplant is there are some people out there that choose to donate their organs in the event that they start breathing, to help save other lives. So those people in America, I don't know about any other country, you can indicate that on your driver's license, on the back of your driver's license, that you want to be a organ donor. So if that happens, if that person should expire, then that person kidney can be donated to someone who is in need. But with that form of kidney transplantation, there's a wait period, because there are so many people that are in kidney failure and need some type of organ transplantation, but there's not a lot of people that are willing to donate their organs. So depending on your blood type, depending on which state you are in, depending on which part of the world that you are in, that wait period can be long, anywhere from 7 to 10 years. It may be shorter, and then also depending on what type of kidney are you willing to receive. There are high risk kidney transplant, so all of those factors come into place to determine how long that waiting period will be for you to be on that transplantation list in order to get a kidney transplant. But that's usually the primary, the first option for treating kidney disease is getting on that transplant list, or if you have a living donor, a family member, or friend that's willing to give you that kidney. So aside from kidney transplantation, the next option that you have is dialysis. Dialysis is pretty much, I'm going to term it like a artificial kidney, or an artificial way to filter your body. So there are different types of dialysis. So it's the process by which your blood and your blood or your system is filtered through this external source. And this machine, like I said, there are different type of dialysis. You have hemodialysis, and then you have peritoneal dialysis. Hemodialysis, you can get hemodialysis in two ways, either by going to a center or dialysis clinic 3 days a week. Plan on being connected to this dialysis machine for about 4 hours, and that depends on what the doctor prescribed for you. So 4 hours, 3 days a week, you will go to this dialysis center, and the staff members there will do your dialysis for you. So this type of dialysis requires a needle and is in blood. So pretty much you will get an access place, and that dialysis access, it can either be a dialysis catheter, which is a device that is placed, pretty much the insertion site is usually somewhere here, but it can be anywhere. The in your femoral catheter, you can have it here, but primarily it's called CVC, a central venous catheter. It goes directly into your artery through your heart. Okay, and this is by through that form that you get the exchanges of blood. So this type of catheter for your dialysis, this type of access is not generally recommended. It's primarily used for emergency situation and if you need it right away. Because why? Because it goes directly to your heart, it increases your chances for getting infection. So because of that, they don't really recommend it. But if you need it for an emergency reason, you have to start dialysis and there's no time to place any other access, they put it in, but you have to get it out. It's recommended that you get it out and you get a permanent access place within 90 days. All right. And the other form of access that you need for your hemodialysis is either a fistula. This is the best choice because it involves some type of mild surgery. So your own artery and vein are connected together and it has to mature, and the maturation time can take anywhere from 4 to 6 weeks. It has to mature. So you go on a surgery, and they connect your own artery and vein, and then you wait for it to mature, and then they start using it. And then this is the best choice for hemodialysis because it's natural, there's less chance of infection, and it's the way to go. Now, if your veins and your arteries are not strong enough because of any underlying conditions, the next option is a graft. Okay, so with the graft, it's an artificial tube. It looks like a straw that they implant it in and connect your veins and your artery with that artificial device. I'm just, trying to bring it in a way that you all can understand, as simple as possible. Okay, so this one can be used approximately 2 weeks after, 2 to 4 weeks after it's inserted. Okay, so that's the second option, the second access option for hemodialysis. So the first is the fistula, the next is the graft, and then the not so last one is the catheter, the permanent cath. Okay, this one is only used for emergency purpose. It has to come out because it's going to your heart and there's a higher chance of infection. So with the artery and the graft, it requires needle access. So they will have to, every time you go for dialysis, the staff will use 2 needles to access your artery and your veins, and then your blood, will get filtered through those 2 accesses. Okay. So hemodialysis, the first, it can be done either you go to a center, and then the next way you can do your hemodialysis is at home. So there's home hemodialysis. For the home hemodialysis, you are trained, your loved one, your family member, you can have a care partner, it can be yourself. The staff will train you properly on how to perform your own hemodialysis in the comfort of your home. This one gives you a lot of flexibility. You do more frequent dialysis. You may have to do your home hemodialysis maybe about 4 to 5 days a week. Don't quote me on it, but these plans will all be put into place between you and your doctor. And your dialysis company will provide you with all the necessary supplies that you need, will provide you with all the training that you need in order to do your hemodialysis in the comfort of your home. All right. So that's for hemodialysis. Now, the other type of dialysis is called peritoneal dialysis. So with peritoneal dialysis, God made our body. He built different parts in our body that we will need eventually. So with peritoneal dialysis, is a dialysis that uses no blood. There's no blood involved, but it uses your abdomen or your stomach area. Because there's a thin, there's a space that's pretty much covering your organs, and then there's that space, and then there's the outer part of your abdomen. So in that space, that's called your peritoneum. That's a sterile space. So with peritoneal dialysis, your access is placed within that peritoneum. So the catheter, I don't have any of those devices to show you. I wish I did. Maybe eventually I will be able to get my hands on one of those that I can show you how it actually looks. I may do another video and I can try to download pictures from on the internet so you can have an idea on how it looks. So now I'm just giving you a brief overview. I may have to do another one so I can actually show you those devices and show you how the fistula looks, how the graft looks, so you can see it. Maybe that will be my next video for next week. So this catheter is placed in your abdomen into that peritoneal space, and then you have a part of it that's hanging out of your abdomen, and then your dialysis center will attach an extension part of that, an extension set to the end of your catheter, and it's through that catheter you will be getting your dialysis. So peritoneal dialysis, it can be done in the comfort of your home too. You get the necessary training that you need, you and your family member. With peritoneal dialysis, is less harsher on your body, is less harsh on your heart, because you is pretty much meant to, you know, I don't know if it's mimic or mimic your kidney function, because our kidney works 7 days a week, 24 hours a day, 365 days in a year. So with peritoneal dialysis, you do it every day, 7 days a week. Okay, so to come close to how your kidney will work. So there's less restriction, there's less fluid restriction, there's less diet restriction, because you're doing it every day. So you get the necessary training, and every night you do your dialysis. So peritoneal dialysis has two forms too. There's one that is done on the cycler, which is a machine, and it's called continuous cycling peritoneal dialysis, or CCPD. So at night, you will set up your machine, you will connect yourself to the machine, and the machine will go through different cycles as you sleep to give you your dialysis, to clean your blood of all the toxins and the waste product. And then in the morning when you get up, you disconnect yourself following all the necessary steps, because infection control is a must when it comes to peritoneal dialysis and any form of dialysis as a whole, but peritoneal dialysis more so, because that peritoneum is a sterile space. So having good aseptic technique, washing hands, wearing masks, making sure if you have pets, they're not in your room, closing your vents, no fan turning. Those are very important when it comes to peritoneal dialysis, because you don't want to introduce any infection into that peritoneal space, because you can get really sick. So and then another form of peritoneal dialysis is called CAPD. So it's continuous ambulatory peritoneal dialysis. That also is done in your home, but that requires you to do, you're not connected to a machine, you don't need any electricity, all you need is a IV pole and your supplies, and you can do it from anywhere. You can travel with peritoneal dialysis. You can travel with either on CCPD or CAPD. And that's it. So with the manual one, which is CAPD, it requires you to do 4 dialysis session, what is called exchanges, during the course of the day. So when you first wake up in the morning, you will already have solution in your abdomen or your peritoneal space. You will do your setup, you will drain that old solution out, and you will fill yourself with fresh solution. You will disconnect, you'll carry that fluid all throughout the day, because as the fluid is in your peritoneal, that's how you get in the dialysis and the clearance of your blood. All right, so after 4 hours, you will go back and do your manual setup again, with you don't have to plug anything in, you just need your pole, and you will drain that old solution out, you will fill yourself with fresh one, and then you'll disconnect and you'll go about with that fluid. So you'll do one for around breakfast, one around lunchtime, one around dinner, and one right before you go to bed, and that one stays overnight until you wake up in the morning. Okay, so we discuss transplantation, we discuss dialysis, and for dialysis, there's hemodialysis and peritoneal dialysis. And with hemodialysis, you can either do it in-center hemodialysis or you can do home hemodialysis. With peritoneal dialysis, there's the CCPD, which is continuous cycling peritoneal dialysis, that use a cycler. You connect at night, you disconnect in the morning. And then there's the manual peritoneal dialysis, which is CAPD, continuous ambulatory peritoneal dialysis. You do 4 exchanges a day. All right, I'm just giving you a brief overview. Okay, but if you choose those options, you're going to get the necessary training that you need from your dialysis facility. But just to give you a general overview on the different treatment options. And then of course the last option is no treatment at all. Some people decide, well, I've lived my life, I'm content with not doing anything. I don't want to do dialysis, I don't want to do transplant, I just let me be. That's an option that you have for you too. So in that case, your doctor and your healthcare team will just mainly be focusing on managing your symptoms, managing your blood pressure. If you start becoming fluid overloaded, because without dialysis, fluid will accumulate in your body, will put pressure on your heart, put pressure on your lungs, you will be struggling to breathe. So they can give you medication to help eliminate some of that fluid from your body. It's not a guarantee, but without dialysis, if you have kidney failure and you don't choose any treatment option, you decide not to do kidney transplant, you decide not to do any form of dialysis, the no treatment option is an option for you. But with that, ultimately, you know, it may not extend your life longer. Okay, so those are the options for you. I hope this video was helpful. I was just giving a general overview. I'm gonna try next week to pretty much show you. I will try to research some things on to get some pictures from Google, just to show you the pictures of how kidney transplantation looks, and how hemodialysis in center look, and how the different access for your choice of dialysis looks, as far as the hemodialysis, the fistula, the graft, and the peritoneal dialysis catheter. So I will try to work on that hopefully by next week. Okay, I hope this video was helpful. Please, if you guys need if you have any questions, any concerns that you have, anything you need me to go over, please don't hesitate to send me a message through Messenger, or drop a comment. I will be more than happy to go over some things with you, to answer some questions that you have, or maybe if you need me to go a little bit more in depth with some of the contents that I share with you, I will be more than happy to do that. Okay, and then I know, especially in America, a lot of our people